Clinical quality measures include technical specifications that are the instructions for calculating the measure. The AAO-HNSF clinical quality measures are categorized as proportion measures where performance is derived by dividing the number of cases that meet a quality action, the numerator, by the number of eligible cases within a given time frame, the denominator. Let's take a look at a sample calculation to understand the anatomy of AAO-HNSF clinical quality measures. We will use an existing measure, allergic rhinitis, avoidance of leukotriene inhibitors, throughout this example. The allergic rhinitis measure evaluates if patients aged 2 years and older did not receive leukotriene inhibitors as primary therapy for allergic rhinitis. The initial population is the target patient group evaluated by a specific quality measure. The initial population often includes criteria related to age, diagnosis, procedure, and the defined measurement period. In our sample calculation, 100 patients are in the initial population. These patients meet the general criteria for measurement. In the allergic rhinitis measure, these 100 patients include all patients aged 2 years and older diagnosed with allergic rhinitis. Denominator exclusions describe circumstances where patients included in the initial patient population are removed from further consideration in the denominator. Although they meet some measure criteria, the numerator clinical action or intervention is definitively not appropriate for these patients. Therefore, exclusions are absolute and apply uniformly to this group of patients. In our example, 10 patients represent denominator exclusions. These patients are diagnosed with asthma or sleep apnea, which are classified as denominator exclusions for the allergic rhinitis measure. Now that the 10 denominator exclusions have been removed, 90 patients remain in the denominator. This is the eligible population. The numerator statement describes the clinical action or outcome that satisfies the intent of the quality measure. This number represents the patients who meet the clinical action or outcome of interest. In our sample calculation, 60 patients meet the numerator. For the allergic rhinitis measure, these represent the number of patients who did not receive leukotriene inhibitors. Denominator exceptions, like exclusions, are used to remove patients from the denominator when the patient is not subject to the numerator action. However, exceptions are not absolute and allow for the exercise of clinical judgment or patient preference. A denominator exception removes a patient from the performance denominator only if the numerator criteria are not met as defined by the exception. In our example, 10 patients are considered denominator exceptions. They are allergic to intranasal corticosteroids or to second-generation antihistamines, which are the recommended first-line therapy for allergic rhinitis and therefore identified as exceptions for this measure. Removing the exceptions, 80 patients now remain in the denominator. Now that we have defined all the elements of a measure, let's calculate the performance rate. We counted 60 patients in the numerator. That is 60 patients aged 2 years or older diagnosed with allergic rhinitis who did not receive leukotriene inhibitors, and calculated 80 patients in the denominator after subtracting 10 denominator exclusions and 10 denominator exceptions from the initial population of 100. We get the performance rate by dividing the numerator of 60 patients who meet the measure by the denominator of 80 eligible patients. 75% of the patients in our sample meet the measure. The other 25% of eligible patients did not receive the appropriate clinical action or intervention. For the allergic rhinitis measure, 25% of patients received leukotriene inhibitors rather than intranasal corticosteroids or second-generation antihistamines as primary therapy for allergic rhinitis. To learn more about quality measures and to view all available measures for reporting through region, visit www.entnet.org/quality.